Next talk would be by our Chief Instructor, Dr. Nirmal sir. Before the era of all these CEAs, all these things, PPP stands for Preferred Practice Pattern, purely on a clinical basis. Now, after these litigations, everything came in, the PPP stands for a Public, Press and Police. How are we going to handle them when such a situation handles?
Thank you, Dr. Jayanthan. And so this was the era when physician was treated as God, but now not only the alphabets, the roles also have reversed. And the current situation is we are blamed for every disaster, and there is attack on the physicians. We keep hearing seeing such videos and news about attack on the doctors, hospitals, and also the reputation damage by the Google review and few other aspects. So how do we save the practice as well as the doctor from this risk? So we all know that there's a golden hour in myocardial infarction. So within 1 hour, we need to initiate the treatment and management. Similarly, there is a golden hour in road traffic accidents. Patient have to be shifted and given first aid. Same way, there is a golden hour in medical emergencies and treatment and violent attack on hospital or hospital staff. So this is basically a pressure cooker situation. So the doctor is in a state of shock, and there's always a biased reporting by press and the other stakeholders, and pressure from the police to settle the case. And there are political splinter groups pressing for compensation and agitation by the relatives or certain self-interest group. So basically, it's a pressure cooker situation. It can go either way. And the reason for crisis basically is 4: doctor-induced, staff-induced, drug-induced, or patient-inflicted. So doctor-induced, basically, we need to remember this. Never take over and above your capacity. And in emergency care, so that this always happen, denial, delay, and death. And we have to be very cautious in communicating the bad news. Suppose there is an on-table death or there is a medical event, we need to convey the bad news in a proper way, document it, counsel and communicate, and also prepare our hospital and team for managing the crisis. Most often it is staff-induced because one of our staff may go and spill the beans. So not complying with the instruction, giving a wrong site, route and drug, and explaining that or rough handling of patients and their relatives. And some patients might be demanding handouts. So all this are induced by our own staff. This is where training also really helps. Drug-induced, we can't do much, but we have to be prepared for it, whether it is look-alike, sound-alike medications or anaphylaxis. We have to ensure that there is a proper documentation of drug as well as the 5 rights on the drug aspect. Patient, basically some of the patients hide previous treatment, cardiac angioplasty or disease status and poor compliance. We also have to understand that these things happen. And so these 4 P's are very important. How we are dealing with the police, press, politicians, and the public. So basically in crisis management, prevention is very important. Face the crisis as well as prevent the crisis by learning from the crisis. So this is one important aspect of facing the crisis, that professional rivalry. We need to change this rivalry to professional bonhomie and bridge the gap between our patients. So how do we do this? So we have to listen to the patient. This is the 5th P. And we need to ensure that we listen to the patient as well as communicate to them. Explain the treatment to the patient. If there are risks, don't hide it. You have to explain the risk to the patient in the language and in the way he and the attenders understands. And get informed consent. This is very, very important. Properly inform the patient and get an informed consent. Document everything you discuss with the patient. Counseling is very important, not only on the positive aspect, never give the outcomes. You also need to give, if there is going to be a poor outcome, give it in writing and counsel the patients. The 5th point is tell them the chances clearly. It may be percentage or it may be a bad outcome. We have to tell them the chances clearly. And the 6th aspect is we need to monitor with CCTV or with people about what's happening, not only in the theater, but also in the outside areas, particularly receptions. We need to know our limits. As eye care center, our ability to treat general emergency emergencies is limited. So we have to know our limits and try to transfer the patient as soon as possible. So if there is a death, so get in touch with a local association and don't declare the death immediately, but ensure you are well prepared to do this. And it's very, very important that you stay in the flock, stay with the AOS, TNOA, or any state bodies, as well as the local IMA group. And the last commandment is basically follow the standard protocols, follow the regulatory requirements from the CEA point of view, and ensure that you learn from the crisis. This is very important. Not only managing the emergency, what you learned from that emergency and what you learned from the crisis is important. So be prepared for the next crisis and emergency. So you need to acquire the knowledge, develop an attitude to act in time, and practice until the skills become automatic, and we need to retain the skills by mock drills. So wish you a crisis-free practice. Thank you all for attending this program and course. If there are any questions, we can take up before the next chief instructor takes his place. No, it's a lunch time. If there are no question, I think we have the next instructor ready here. So thank you for attending our course. Thank you for your time and attention.